As the world battles a global pandemic, another silent storm is brewing in the minds of people. The WHO estimates that 1 in 4 people suffer from some form of mental health issue. This problem manifests itself further when the conversation is about people living with disabilities. According to a WHO report, many of the development programs fail to reach persons with disabilities who require them. It's estimated that nearly 75 to 85% do not have access to any form of mental health treatment. Today, we take a look at the findings of a study conducted by Rising Flame and Sightsavers on the impact of the pandemic on the mental health of people with disabilities. In her article on the trauma of an ableist world, disability rights activist Nidhi Goyal says discrimination is a constant, with abuse and violence not far away. In such an environment, many persons with disabilities tend to internalize the stigma and behaviors they encounter. These realities shape the conversation around persons with disabilities, which is generally couched in terms of their basic survival rather than their right to live their lives to the fullest. According to the report, many people with disabilities talk about difficulties in projecting an independent self in order to be accepted in our society as able. Several other access barriers also prevent them from seeking therapy. For example, lack of family support, paucity of therapists trained in sign language, accessible locations for mental health clinics, and specialized training to cater to the emotional needs of persons with disabilities. The Covid-19 pandemic has made many of these situations worse, owing to the uncertainty, isolation, and fear of contracting the disease. Article 19 of the Convention on the Rights of Persons with Disabilities places an obligation on the state to ensure that persons with disabilities can live in the community with the support that they require to live independently. There is also an obligation to ensure the availability of services to prevent persons with disabilities from being isolated or segregated from society. However, with physical distancing being the need of the hour, many persons are not able to maintain access to these networks. The impact of isolation and anxiety around the pandemic has had adverse effects on women with psychosocial disabilities. A report by the Bapu Trust for Research on Mind and Discourse includes narratives of several women with psychosocial disabilities and notes their increased anxieties due to unique stressors that have emerged during this time. The sudden change in structures and systems, being confined in abusive situations, and being exposed to very disturbing news cycles have affected many of them and have even exacerbated their conditions. The recommendations that the study has made in order to deal with the negative impacts of the COVID situation on emotional well-being of people with disabilities are: ensure access to support for all persons, including those experiencing mental or emotional distress during the COVID-19 outbreak, to call in person and online psychosocial support and peer support based on respect for individual will and preferences. Ensure the development and availability of a wide range of community-based services that respond to the needs of persons with disabilities. Mental health responses need to be embedded in the COVID-19 recovery for persons with disabilities, with specific focus on women with disabilities.